Hello. Today we're going to talk about reflective practice and different modalities of debriefing and other techniques which are used. What this means is like let's say that you're in practice, you're in inpatient practice or outpatient practice. Reflective practice or debriefing is used to improve your functioning as a nurse practitioner. So you, as a clinician or a nurse practitioner, so you do something and you kind of see, okay, did I handle this situation well or not well? So it is a process to evaluate, improve, and implement. So let's look at some examples. So for example, like let's say that you're in an inpatient unit and there is a behavioral outburst in the emergency room. So a patient exhibits a intervention which results in like either verbal de-escalation or medication or restraint. Now you want to see if the debriefing will be to review the team's response and assess its effectiveness to ensure that staff and patient safety was maintained, to identify is there an improvement we can achieve in this, and like to process the emotional aspect impact on the staff. Like whenever these kind of incidents happen where a patient gets aggressive or somebody gets hurt, a lot of emotions get involved because you're hurt or you felt like things didn't go well as you planned. So what first of all you want to do is that you set a context. That means that you're describing this event sequence of events, what triggered the crisis, what triggered, how did the team respond. Now, ensure that all team members share the same perspective or everybody's perspective is taken into account. Now, discuss strategies to reduce the likelihood of similar incidents in future. Now, you create a safe space, that is, allow the staff to express their feelings about the event without fear of blame or judgment, and foster trust among team members to encourage an open dialogue that everybody is able to talk about it and things like that. And then you can do this by probing questions also. Okay, what early signs indicated that patient might have escalated? Were actions aligned in patient's care plan? What could have been done differently to de-escalate the patient? And what can alternative decisions could be, and what can we learn from this? That's one way of thinking about it. Other way of thinking about is um, a debriefing process of reflecting, analyzing, learning, and planning, where team identifies that the in a reflection part, a team identifies that the patient became agitated due to the noise level of an environment. Now, analyzing part, you're saying that de-escalation techniques were delayed because early warning signs of distress were missed. Assumptions about patient's refusal to comply were incorrect, and it stemmed from anxiety, not defiance. So patient was anxious but not defiant. Now, what do you learn from this situation? It's important to recognize that early signs of agitation, like somebody's pacing, muttering, and things like that. And you want to train the staff on non-verbal communication techniques and how you need to understand. Now, in a plan section, you're adjusting your patient care plan about quiet environment, giving sensory breaks to minimize overstimulation, and then conducting team training for de-escalation strategies. Now, other ways of thinking of this is also um, plus delta star, where we are thinking about strengths, where we are thinking about identify what the team did well, and then highlight where the team could do better, and then explore ways of preventing further, like what are the opportunities, how can we improve better. And in a different debriefing technique of ladder of interference, you want to say analyze assumptions, means like did the team assume that certain behaviors were intentional rather than driven by patient conditions? And then you examine their beliefs, where all actions rooted in patient-centered care, and could there be another method like you're challenging your thinking and seeing, okay, could it be a been different way you could have done that. There is also a ways of like debriefing wheel where you're evaluating all aspect of the event, patient's triggers, staff actions, and you're looking at all like outcomes and lessons in a debriefing wheel. So, the better way to do it is keep trying regular sessions in improving this process, or like, looking at the workflow, and then as you identify things, you create strategies to improve. So it's a way of practice and way of root cause analysis of events, and then analyzing it and trying to improve yourself as a provider and as a team. Mainly works in an ED setting and an inpatient setting, but also can be utilized in outpatient, but mainly like agitation episodes or restraint episodes or things like that. This could be utilized. Thank you very much.